Hello everyone and welcome back to my channel. For my new subscribers, I just want to say a big thank you, and for my old subscribers, thank you for holding it down and still being here. On today's episode, I would like to talk about something that has been bringing up a lot of debate in the social media space, and that has to do with the current state of the economy. Now, everyone knows worldwide that it's becoming a problem now. Making ends meet, so the prices of things have gone up, prices of goods, prices of services, and everybody is complaining about the global economic inflation, or will I say economic meltdown? Let's put it that way. Now, and on it's really important because I think with the way things have become a bit difficult financially worldwide anyway, so with the rise of the cost of goods and services and the economic inflation everywhere, people are beginning to rethink the number of children that they would have, especially people who are married, even those who are not married and decide that, you know what, I want to have children. Now they're beginning to rethink their choices. Now, this is where I would say that it is advisable to have the number of children that you know you can take care of. When I mean take care of, I mean holistically. So financially, psychologically, physically, emotionally. Okay. So if you know that you cannot take care of more than one child in all this holistically, then it's just best you stick to having only one child. If you know you can do two, you know you can do three, do judge, but just don't have the number of children that you know you won't be able to take care of and then bring them to the world to suffer. But here's the catch: science has made this easy for us, and that is why we have something we call contraceptives. Now, today I'm going to talk about contraceptives. It's a very broad topic, but I will try to make it as brief as possible. As you guys know, I do not like to make really long videos because I feel like you might get bored listening to me yap and yap and yap for over 10-20 minutes, but I'm going to try and see what I can do to sort of compress all this information. What I'll do is just give you the basic information that you need, and if you need further information, you'd have to contact your medical provider. When I mean medical provider, I mean maybe your nurse or your doctor or your pharmacist, and to give you more in-depth information about everything I'm going to say now. So there are two types or two kinds of contraceptives, and I'm going to classify them based on short term and long term. Okay, short term and long term. Okay, so let's see. The first set, we call them the reversible ones. So when we say reversible, we are saying if you take this contraception, okay, if at any point in time you change your mind and you decide that you want to have kids, you can actually stop taking them and you'll be able to have kids. Okay. Now, the other kind is the irreversible kind. So the irreversible kind is the one which, once you've done it, you've done it. Okay. It's difficult to go back and reverse. And even if you try to reverse it, the possibility that you'll be able to conceive after reversing is still kind of low. So it's neither here nor there. Okay. So yeah, so those are the two types. So under the reversible ones, those are the ones that I know that are really, really common now. One of them is called the combined oral contraceptive. Okay, so those are the pills. So those are the pills. Okay, so we have two types of pills. We have the combined oral contraceptive, which has estrogen in it. Okay, and we have the progesterone only pill. Okay, so there are two pills now. One of them you have to take it every day, and then you have a pill free period of 7 days, which is a combined oral contraceptive. Now, the other one, which is called the progesterone only pill, which is also known as the mini pill, you have to take every day, so there are no breaks in between. Now, the good thing about these pills, that one you want to take, okay? The good thing about them is that once you stop taking the pills, your fertility will return. Okay, so this is for people who just want short term, something really short that they can actually use to, space their kids. Okay, so let's say, for example, you want to have 2 or 3 kids, and then you want to have a space of 2 years in between. So for people who want those sort of short spacing, you can actually use this contraceptive pills and be able to achieve your child's spacing. So obviously there are some criteria that you have to meet to be able to use either the estrogen pill, or if you can't, estrogen pill. Now if you cannot meet up those criteria, then you will move over to the mini pill, which is the progesterone only pill. But I won't go into details with those criteria because obviously this is just like a general overview of what kind of contraceptives are available for you to use. Okay, now, so the next one will be the injectables. So this one is called the Depo shot. So it's a hormone called Depo-Provera. So what you normally do, these are for females anyway. The pills are for females. Even this injection I'm talking about is for females. So for the injection, you have to take a shot. So it's intramuscular. What I mean by intramuscular is like they're going to put it inside your muscle. Okay, so they're going to inject it inside your muscle. So you take this one every 3 months. Okay, so if you take the injection now, the next 3 months you go for another shot. Okay, you must keep going for the shots. Okay, if you stop going for the shots, you're going to get pregnant, and you don't want that. So you have to keep up with that. Like I said, this one is also reversible. If you stop taking it after a while, most women would go back maybe to like being able to ovulate in like maybe 6 months to 12 months, but you would be able to reverse back to your usual, ovulation and fertility if you decide that you want to have more children. So that's for the injectables. Now, the next one we'll talk about will be the Implanol. Okay, so Implanol is more like a hormone too that they put under your hand. So it's just under your skin, under the skin in your arms, in your hand, sorry, just under the skin. So it's subdermal, just under your skin, okay? And they put it in there and it lasts you for about 3 years. So you're going to not worry about anything. You don't have to worry about, oh, I need to go back to my doctor and get an injection after 3 months, or oh, I need to wake up in the morning and take these pills again. So it's just going to be there for 3 years. This one is good for people who want longer term contraception. Like, okay, if you want to space your kids 3 years in between, you can use Implanol. Like I said, there are a lot of different criteria that you would need to meet to be able to be placed on whichever form of contraceptive that you choose. These are the things that you would have to discuss with your healthcare provider, and you come to a suitable one for you. Now, this is in before I go further, I just wanted to know that every form of contraception has its advantages, and obviously it's got its own side effects. Okay, so when it comes to medicine, what we would normally say is that if the benefits would outweigh the risks, then it's good to go ahead with it. Okay, so every medication that you take, every contraceptive that you use would have its own side effects. So you would have to also discuss these side effects with your healthcare provider. Okay, to be sure that you have all the information, you're equipped with all the information you need before making a choice of the contraceptive that is suitable for you. Okay, so the next one would be the IUD. So there are two types of IUD. There's one that's called the copper IUD. So that one doesn't have any form of hormone inside it. And the other one is the hormonal IUD. Now that's the Mirena one. Now for the copper, for people who do not want to use the hormonal IUD, you can put you can have it inserted. So what they do is they just put it through your vagina, pass through your cervix, which is the neck of the womb, and the device sits in your womb. Okay, so that's what it does, both for the hormonal and both for the copper one. Now, the good thing about it is that this is a long-term contraception. So I think for the hormonal one is up to 8 years now, so it can last you up to 8 years. Now for the copper one can even last you up to 8, 10 years, okay, without even taking it out. So this is for people who are done having kids, don't want to have kids anymore, just want to keep covering themselves till they get to menopause. So this is for people who have completed their family size. Most people would say, oh, I'm not having any more children again, so I would like to go for something that is going to take me a long time before I would need to change it again. Okay, so that's it. So is another one that is less popular is a female condom. So female condoms, I can't remember the last time I saw a female condom anyway, but it's something like a female condom. So obviously it uses the same way you use the male condom, but this time around you put it inside the vagina. So that's the whole mechanism is the same. It's just to prevent direct contact with the vaginal wall during sex. So that one is just for like a short term, you know, contraceptive, something you can just use, you know, and yeah, for some people, I mean, if you're the type that would prefer to use things like a condom, then that's fine. It's okay. You can actually use a female condom if you want. Now, for the ones that are irreversible, this is for still on the females. So for the irreversible contraceptive, what we can the other one that we can do is, one, you can actually ligate your tubes. So what that means is that you tie your tubes tie them, and then that's it. So it's called female sterilization. So you sterilize yourself this way and you are safe. You're not able to have children. Now, a lot of people, I've seen a lot of posts on social media where women have said they've tied their tubes, and they still ended up pregnant. Well, yes, obviously they it's not like 100% effective, but there will be some rare cases where even with those measures put in place, even with sterilization, they somehow manage to get pregnant, and things like that. Now, that is sterilization for females. It's supposed to be irreversible. So once you've done it, once you've slashed up, once you've tied your tubes and you've cut off your fallopian tubes, there's obviously no way to reverse it. Okay, so that makes you sterile and you'll not be able to have kids. Now, for the males, there are only two types of contraception for the males right now that are still in use. Yes, they're working on something that they can actually give to men too that would help, with contraceptive, but obviously it has not been licensed to be used yet. So, but the two ones that are for men are one, the male condom, which is the very popular condom. So, as a man, if you want to prevent yourself from having children that you don't want to have, you make sure that you use a condom. And the good part of using a condom is that it not only prevents unwanted pregnancies, it also does prevent STIs. Okay, so the male condom is another way. So even for females too, I mean, you should learn to have condoms in your around in your house, some in your drawers, everywhere. There's no harm. I know there's a lot of stigma about women going around, with male condoms. But I mean, if you know that you're going to meet your partner or your boyfriend or your husband, you too can have those condoms, available, where you can use them, give it to your partner, your male partner, to use and to help to prevent unwanted pregnancies. Obviously, there's also failure rate. There's also failure rate with all these kind of contraceptives, but some of them have a higher failure rate than others. Okay, some of them have a lower failure rate than others. So these are some of the things that you need to discuss with your healthcare provider when you go to discuss about contraceptives. So these are some of the things you should ask for: failure rate, okay, side effects, okay, and then the criteria. Some of the criteria, because if you have some sort of medical condition, you cannot use certain contraceptives. So these are some of the things that you need to discuss. Okay. Now, the next one for the male, the other one is male sterilization, so which is called vasect. So for the males, male sterilization is also known as vasectomy. So they literally just clip up the tube that transports the sperm up through the penis. They just clip it up and just make sure that its bond is clipped for life, so no sperm can actually pass through there and the man cannot impregnate a woman. Okay, so sometimes along the line people would want to reverse these things. Even if you go back and try to reverse it, the possibility of you getting back your fertility reduces. Okay, but reduces, and the longer you stay sterilized, the lower your chances of your fertility returning if you try to reverse it. So that's called vasectomy. So for the men, if you know that you're done having children, you've had the number of children that you want to have, you can as well go and have a vasectomy rather than make your wife go and get contraceptives, especially if she's the type that's having side effects with most of the contraceptives. Because I've had a lot of patients come and say, look, I'm having side effects with this thing, this, I'm not coping with this, I'm not coping with that. And then in the end, the husband has to go and have the vasectomy because they're done having the number of children that they want to have. So we've discussed the different types of contraceptives, both for the males, both for the females, the ones that are reversible, the ones that are irreversible. And it's left for you to sort of go speak to your healthcare provider and talk more about this, your different options. Hope this episode has actually been very helpful to you. We've discussed the different types of contraceptives, and coming up next, we will discuss in detail the different kinds of contraceptives. We will discuss their side effects. We will discuss the effective the failure rates, okay, and we discuss the good part of it, the advantages of it, so that you're well equipped to make a decision concerning the contraceptive that you would like to use. I hope this episode has been helpful. If it's been helpful, please share like, and subscribe to my channel. Until next time, see you later. Bye.